session, sir. Let's move on to the next session on vitamin D. I invite the chairperson, Dr. Satish Kumar Kamalanathan, Addition Professor Endocrinology, Jipmer Puducherry. He has won the Best Reviewer Award of IJEM for 2013, started by the Department of Endocrinology in Jipmer at 2010. He has multiple publications and written many book chapters. I also invite Dr. Krishnan Swaminathan, Consultant Endocrinologist, President, KMCH Research Foundation, Coimbatore. He is the founder of Idayangal Charitable Trust, supporting 200 poor children with type 1 diabetes. He has multiple publications. I request the chairpersons to introduce the speakers and take over the session.
Good evening, ladies and gentlemen. It's my proud privilege to introduce Professor Michael Holick, who is identified as the authority in vitamin D. He currently holds the position of Professor of Medicine Physiology and Molecular Medicine in the Boston University Medical Center. And he is credited with the discovery of both the 25 hydroxy vitamin D as well as 125 dihydroxy vitamin D, and we associate with his name with the guidelines for vitamin D deficiency prevention and treatment. And additionally, he has more than 1 lakh citations and is recognized by the Google Scholar for that, from more than 600 publications in various peer-reviewed journals. Sir, the platform is yours for the topic of vitamin D deficiency, dilemma, and its health consequences.
Can you see my screen?
Yes, sir. It's there.
Well, thank you very much for that kind introduction. It's a real pleasure to have an opportunity to share with you the vitamin D deficiency dilemma and its health consequences. And I'll talk a lot about health benefits from birth until death. Now, people worry about conflict of interest, so I do get support from NIH, and I consult for a variety of companies over the past several years. But much to the dismay of the dermatology community, I also get support from the Sun. And you can go to this website, drholick.com, for more information about vitamin D. Now, I'm sure you all know Dr. Marwa, right? And he was always asking me, so what am I going to tell you about vitamin D that you don't already know about? And I thought I would seek higher counsel, but I went to a physician that I think you all know and recognize for his area of expertise. This is what he told me, that I'm an idiot, right? Why? Because the Institute of Medicine, of course, came out with its recommendations, and what more can you know? What's amazing about the recommendations is that originally the RDA for vitamin D was 200 units a day, and they recommended that it should be at least 3 times as much. The upper limit, they also recognized, was not 2,000 units a day, but adults could easily take 4,000 units a day. Constantly asked about, what do I think about this? And I can tell you, I have one word for it: wow. Because there's never been a nutrient that has been tripled overnight. But the question is, did they get it right? And so in 2011, the Endocrine Society Practice Guidelines Committee, and I was fortunate to chair that committee, and all of the members on this committee are experts in the field of vitamin D. And our objective was clear: evaluate, treat, and prevent vitamin D deficiency in patients. The Institute of Medicine was not intended for physicians. It was up to professional associations to make these recommendations. And they used a population model, not a medical model. So it's not a surprise that there would be different recommendations. So the Endocrine Society recommends infants, 400 to 1,000 units a day. Children, 600 to 1,000 units a day. Adults, 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more. So vitamin D, I've been talking about for more than 50 years, and people cannot think of a more boring subject. But we're now recognizing that who is at risk for vitamin D deficiency? And essentially everyone is. And why do you care? Because really rickets is the tip of the iceberg. Osteomalacia, diabetes, multiple sclerosis, rheumatoid arthritis, infectious diseases, hypertension, heart disease, common cancers have all been associated. And of course, this is a bone symposium. And so vitamin D, of course, is critically important for bone health. So I thought I'd bring you a case that you may not typically see in your own practice. 7-month-old female, muscle weakness, tetanic seizures, and a calcium half normal. This infant was about to die. And it turns out it's the first lowland gorilla born in captivity at our local zoo, seen by a pediatrician, given 400 units of vitamin D, didn't do any good, concluded the infant had some rare metabolic disorder, nothing you could do about it. Well, baby's complaining to mom about bones aching, and dad's upset. Have you ever wondered what he was trying to say? That's what he was trying to say. And indeed, mom asked them to call me, and I got to see this infant. Infant has classic widened epiphyseal plates, classic for rickets. How do you treat? Aggressively. I gave the infant 5,000 units of vitamin D a day, and the infant's feeling great. In fact, I was the guest of honor for her first birthday. Message, mommy, will my growth be stunted because of her in utero and her first few weeks of life of vitamin D deficiency? She had significant growth retardation. We estimate more than 50% of infants born today in the world are born deficient or insufficient. In 1889, rickets was common. Is it a problem today with all the modern medicine? You better believe it. We see about a dozen cases a year at our hospital. Why? Because it's suggested that human breast milk is the sole source of nutrition for infants. And so often pediatricians will recommend this to the moms. There's essentially no vitamin D in human breast milk. So if you give your infant human breast milk as a sole source of nutrition, breast milk, that infant will be vitamin D deficient for that period of time. Now, I'm not sure what Brittany's thinking about, but we asked another question, right? Because I'm sure pregnant women are being followed very carefully. So what if they're taking a prenatal vitamin? Are they getting enough vitamin D to satisfy that requirement? So we did a study in 40 mother-infant pairs, and we showed they were taking 600 units of vitamin D a day. This is the amount of vitamin D recommended by the Institute of Medicine for all adults, including pregnant women. And we reported 76% of moms, 81% of newborns were vitamin D deficient. Now, why should you care? Because preeclampsia, the most serious complication of pregnancy, we showed with Lisa Bodner many years ago, the higher your blood level at the time of your pregnancy, lower is your risk for developing preeclampsia. Also, vitamin D is very important for muscle function, which of course is important for birthing. And so we did another study at our hospital, and over 200 patients that came into the hospital to deliver, we measured their blood level of 25-hydroxy vitamin D and showed a 400% reduced risk of requiring a C-section just by being vitamin D sufficient. What about prematurity, a major health issue, right, for infants? Turns out that blood levels of 25-hydroxy vitamin D are related to gestational age. 60% reduction of premature birth if mom is delivering an infant at the age of, a level of 40 nanograms per ml. So mom, thanks for taking your vitamin D, right? So what is Christina thinking about? What we recommend for all pregnant women, they should be on 2,000 units of vitamin D a day. How much vitamin D do you need to give a lactating woman to put enough vitamin D in her milk? Bruce Hollis and Carol Wagner showed 6,000 units of vitamin D a day. This is telling us from an evolution perspective, likely how much we all need. It makes no sense that human breast milk should not have had enough vitamin D to satisfy their infant's requirement. Pediatricians have been paranoid about vitamin D for infants. They worry about toxicity. So how much do they need? Even the American Academy of Pediatrics recommends all infants 400 units of vitamin D a day. So is it true? You would think with healthy diet, right? You heard in the last talk with thyroid that you need a healthy diet. Are you getting an adequate amount of vitamin D? And the answer is no. Even in the United States, where food was fortified with vitamin D, we showed that no one can get enough vitamin D. In fact, milk, of course, is fortified with vitamin D in the United States. And the good news is in India, in 2017, finally, the Indian government began recommending fortifying milk and cooking oil with vitamin D. And there's 550 international units of vitamin D2 in a liter of milk. Now, you may ask the question, in cooking oil, when you're cooking, are you going to destroy the vitamin D? Turns out vitamin D is heat stable, and so it's perfectly fine. What about mushrooms? If you expose mushrooms to sunlight, it's a great source of vitamin D2. This is where most of your vitamin D is coming from casual or not so casual exposure to sunlight. Out there making lots of vitamin D in the summertime. And so when you're exposed to sunlight in the summer, the sun is coming directly through the ozone layer and you're making vitamin D. But what about in the wintertime? Wear more clothing, the sun's rays are coming in at a more oblique angle. Can you make any at all? So we did a study and showed in Boston, in the spring, summer, and fall, you can make vitamin D. November through February, none. So the question, of course, is, and Dr. Marwa called me up and said, you know what, test tubes up on the roof is good, but we need evidence-based medicine. And so I went to my students and I said, I need a volunteer to go up on the roof to prove to people you can't make vitamin D in the wintertime. So I finally got a volunteer, and you make no vitamin D in the winter in Boston, right? And so if you're up here, like my daughter in Vermont, and go down for a spring break in Florida, you can make it year round. But guess what latitude? If you live above and below about 32 degrees north or south latitude, you make no vitamin D in the wintertime. And that includes, for example, in New Delhi. So you have plenty of sun. So studies have been done in India, and I work with Dr. Hari Anand on this, and we showed that even though you may suggest that you go out in the early morning and late afternoon, go jogging, make your vitamin D, no. It's great for romance, but you will not make any vitamin D. 10 a.m. until 3 p.m. And he showed very nicely with the data that here you go, at 9 a.m. you're not making any vitamin D. And it's only around 10 a.m. until about 2 to 3 p.m. that you make vitamin D in your skin. How do you know your vitamin D status? I think you're well aware you want to measure 25 hydroxy vitamin D. And the normal range is 220 to 100 nanograms per ml, or 50 nanomoles to 250 nanomoles per liter. But we don't have time to look at numbers, right? So is it H, is it N, or is it L? And so typically I see some patients coming back from summer vacation and they're at 110. Are they intoxicated? No. So what about in lifeguards? Well, I don't see the Baywatch babes in my clinic, right? But they're probably at 110. Are they intoxicated? I don't think so. You don't have to worry about vitamin D intoxication until you're at least 150 nanograms per ml. The lower limit, right? What is the evidence that you should be at 30 nanograms per ml or 75 nanomoles per liter? We did a study in postmenopausal women throughout the entire United States with Andapap and showed the higher your 25 hydroxy vitamin D level, lower is your PTH, and it plateaus at around 30 nanograms per ml. 3 times higher risk of having secondary hyperparathyroidism at 21 versus greater than 30 nanograms per ml. Is vitamin D deficiency a health issue, right? What about in sunny India? Right here, Hari Anand and many others have shown, Dr. Marwa as well, that well over 50% of children and adults in India are vitamin D deficient. One of the reasons for why some foods have now been fortified with vitamin D in India. And so globally, 40% of the world is deficient, 60% deficient or insufficient. And so the Endocrine Society recommends at a minimum, you should be at 30 nanograms per ml, 75 nanomoles per liter, and ideally 40 to 60 nanograms per ml. Vitamin D deficiency, right, will cause secondary hyperparathyroidism and exacerbate osteoporosis and cause a painful bone disease, osteomalacia. So it precipitates and exacerbates osteoporosis. Why? Because what's happening is you're increasing PTH, increasing numbers of osteoclasts. You're chewing up the mineral and the matrix, as a result, causing porous bone, i.e. osteoporosis. And this shows it very nicely. Here's normal healthy bone, and this is what's happening. You're cavitating the bone, removing the calcium in the matrix. Osteoporosis is a silent disease, right? Holes in your bones does not cause bone pain. Osteomalacia is not so silent, right? Typically, curiously, your aches and pains occur in the wintertime. I wonder why, right? Symptoms: generalized bone pain, isolated bone pain, muscle aches and pains. Often these patients get the nouveau diagnosis, right? Fibromyalgia, chronic fatigue syndrome, or even they're written off as being depressed. Many of these patients I see in my clinic are vitamin D deficient and have dramatic improvement in their symptoms after 6 months on vitamin D therapy. Even the Mayo Clinic proceedings reported 150 children and adults, aches and pains in their bones and muscles, 93% vitamin D deficient. He's constantly complaining to his dogs, "My bones and muscles ache." The dog told him, "Stupid, you're vitamin D deficient." We want everyone to be at least 30 nanograms per ml, 75 nanomoles per liter. Good for maintaining bone mineral density, good for maintaining muscle strength, less likely to fall, less likely to fracture. How do you treat it? Well, when you go to your gas station, do you get a gallon or liter of gas? No. And so the way we treat in the United States, and I know that you have a 60,000 unit dose of vitamin D2, is I give 50,000 units once a week for 8 weeks. It's equivalent to about 6,500 units a day. But then the doctors don't know what to do. They're thinking, well, maybe I need to put my patient on 1,000 units or on a multivitamin. No, because if you're putting them on 60,000 units once a week, now you can switch them to 60,000 units every 2 weeks. That's equivalent to about 3,300 units of vitamin D a day. Now you may say, right, vitamin D is fat soluble. Is this going to cause any kind of toxicity? Well, Einstein worried about this. So we did a study. We did a 6-year study in my clinic, and we showed 6 years on 50,000 units every 2 weeks, blood levels in that preferred range of 40 to 60 nanograms per ml with no toxicity. 1,000 units a day, by the way, we showed will not make you sufficient, at least in Boston. But can you give 60,000 twice a month without screening? That's a major issue, right? A, not always available. B, expensive. And sometimes C, some of these assays aren't very reliable. So we did another study, 6 years. I took all comers coming to my clinic and I gave them the same dose, 50,000 units once a week for 2 weeks. And we showed very nicely that even without screening, and the Endocrine Society recognized this study, right? 50,000 units twice a month, right? No baseline measurement. Some started out at 50 nanograms per ml. They went up to 80 nanograms per ml. Up to 100 is perfectly safe. So in my opinion, unless you have sarcoid or some kind of rare disorder that makes you hypersensitive to vitamin D, or you have malabsorption problem, or you're obese, you don't need to screen. My recommendation is to treat. What about vitamin D2 versus vitamin D3? Right? A lot of controversy on the internet. So we did the study, and we've shown that 1,000 or 2,000 units of vitamin D2 is as effective as 2,000 units of vitamin D3 in maintaining blood levels. What about intoxication? Right? You have to take a lot of vitamin D to become intoxicated. Bob Heaney and we showed 10,000 units a day, perfectly safe. In Canada, up to 20,000 units a day in adults for years, safe, never above 100 nanograms per ml. What about infants and children? And so a study was done at Children's Hospital by Catherine Gordon. 2,000 units a day or 50,000 units a week for 6 weeks is effective in treating infants and children with vitamin D deficiency. What about pregnant women? Bruce Hollis and Carol Wagner showed 4,000 units a day gets their blood levels in the ideal range of about 50 nanograms per ml. No change in serum calcium, no change in urinary calcium, no evidence of toxicity. Can you become toxic? You better believe it. This gentleman went on the internet and bought this product. He thought it was 1,000 units in a teaspoon, took 2 teaspoons a day. The company forgot to dilute it. There was 1,000,000 units in 2 teaspoons. He was severely intoxicated, calcium of 15, 25-hydroxyvitamin D of 500 nanograms per ml. I saw that patient in my clinic, stopped all calcium, all vitamin D, and his calcium quickly came down, and his 25-hydroxyvitamin D gradually came down, and there was no untoward complication. It is difficult to become vitamin D intoxicated. So why should you care about all of this, right? Because we know vitamin D, of course, goes to your liver and then to your kidneys to get activated, to regulate calcium metabolism. But surprise, surprise, we now know that essentially every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having an effect? What about those other functions? Well, with the COVID problem affecting the entire world, right? And a recent suggestion that vitamin D may have some hope, maybe we can gain some insight to some of these extra skeletal effects of vitamin D. And so, is there any benefit that vitamin D can provide during this pandemic? The immune system we've known for more than 30 years is responsive to vitamin D. Inactivated T lymphocytes have no receptor. When you activate them, they do. And once you incubate them with active vitamin D, they regulate a wide variety of cytokines and proliferation and differentiation of T cells. B lymphocytes resting, no vitamin D receptor, activate them, and they do. Why? Because it modulates immunoglobulin synthesis, likely reducing risk for autoimmune diseases. Activated macrophages, as you're well aware, activate vitamin D. Have you ever wondered why? We now know why, right? 1849, cod liver oil treating TB. TB protects is protected using vitamin D. 2006, Adams, Maudlin, and Liu showed if you infect a macrophage with an infectious agent, virus or bacteria, the first thing that gets done, it tells the cell to activate vitamin D by increasing the expression of the enzyme that converts 25-hydroxyvitamin D to 125D. Why? 125D then tells the cell to increase expression and production of defensin proteins, including cathelicidin, which then kill infectious agents. And so this is why living at higher altitudes probably was effective in preventing TB. We know the flu season occurs in the wintertime, right? And there's a seasonal stimulus. Peak flu season is when the blood level of 25-hydroxyvitamin D is at its lowest level. And so a study was done in New Haven, Connecticut at Yale, and they showed if you maintain a blood level of 38 nanograms per ml, you reduce risk of upper respiratory tract infections twofold. Randomized trial in Japan showed school children taking 1,200 units of vitamin D a day reduced risk of influenza A infection 42%. What about the effect on the immune system? Ultimately, it's our genes that know. And so healthy adults for 12 weeks on 2,000 units of vitamin D a day. CHIP analysis of almost 23,000 genes. All of these blue lines are underexpressed genes. All of these orange and red are overexpressed. 291 of them. Just on 2,000 units of vitamin D a day, all of these genes were turned on and all of these genes were turned off. What are they doing? Turns out that up to 80 different metabolic processes are being affected. DNA repair, apoptosis, oxidative stress, metabolic processes, and anti-inflammatory activity. Feed your genes right with vitamin D. So the COVID, right, innate immunity, right? 125D and cytokine storm, right? We know that very important. 125 dihydroxyvitamin D regulates monocyte, dendritic, and macrophage activity and regulates nearby by expressing 125 dihydroxyvitamin D locally in a paracrine fashion to regulate T cell activity and to regulate and downregulate cytokines that potentially are damaging to your body and upregulating cytokines that are important. We know that this virus very cleverly gets through the ACE2 receptor. And it's interesting that 125 dihydroxyvitamin D helps to regulate the renin-angiotensin system. So there's evidence to suggest that it may be playing a significant role. So nice theories, but where is the evidence? And so we did a study, and not in a few hundred, not in a few thousand, but in over 191,000 patients in the United States presented with COVID-19 positivity. And we related it to the 25-hydroxyvitamin D level. At 20 nanograms, 30 nanograms, you could see very nicely dramatic drop in the incidence of this infection. All the way out to 60 nanograms per ml, a 54% reduced risk of acquiring this infection. What about people of color? We know, especially in the United States, much higher risk of acquiring this infection and more severe consequences. And so we did look, and we showed that for Hispanic and African Americans, the higher the 25-hydroxyvitamin D level, lower was their risk of acquiring the infection. Northern versus southern and central latitudes, higher latitude that you live, likely lower is your vitamin D status. And therefore, if you take vitamin D and improve your vitamin D status, it still has a significant benefit. Age, it's thought that you're much higher risk of acquiring it and having consequences. The age had no effect. The higher your 25-hydroxyvitamin D, lower is your risk. And male versus female, no difference. But will vitamin D improve health outcomes? So we did a small study in Iran with Dr. Megaloli, and we showed in 235 patients that presented, 74% had severe disease, right? We looked at severity, unconsciousness, hypoxia, C-reactive protein, and lymphocyte count, and they were all much more positive in the direction of helping to reduce morbidity and mortality. In fact, we did look at mortality, and under the age of 40, we saw no deaths. But at 40 and above, significant number. And when you relate their 25-hydroxyvitamin D level, a 51.5% reduced risk age over 40 years of age, just by being vitamin D sufficient out into the range of about 60 nanograms per ml. And so we got a lot of publicity. Vitamin D may be able to help reduce risk of acquiring this disorder. Vitamin D deficiency is a disease of neglect, right? A lot of evidence, important vitamin D from birth until death, right? Vitamin D deficiency has been associated with reduced risk for mortality, autoimmune disorders, common cancers, type 1 and type 2 diabetes, hypertension, as well as complications of pregnancy. So when you think about disease burden, right, low birth weight, stunted growth, type 2 diabetes, hypertension, fracture, cancer, infectious diseases, and this is a study done by Dr. Marwa, you could see soldiers, physicians, and nurses, their blood levels are essentially undetectable. Vitamin D deficiency is a significant health issue. And autoimmune disorders, right? Don't think about a normal level, but a healthy level. Just like this group, right? These are hunter-gatherers out in Kenya, right? Exposed to sunlight all the time. Their blood levels, 40 to 50 nanograms per ml. How do you get there? You would need to be on about 4,000 to 5,000 units of vitamin D a day. And remember what I said about lactating women? If they take 6,000 units a day, they put enough vitamin D in their milk to satisfy their infant's requirement. This is what we think that we all need to satisfy maximally our vitamin D requirement for maximum health. Goal, in my opinion, at a minimum should be 30 nanograms per ml, 75 nanomoles per liter. 40 to 60 nanograms per ml is recommended by the Endocrine Society. Up to 100 nanograms per ml is considered to be safe. How much do you need? We know that once you're at around 50 nanomoles per liter or 20 nanograms per ml, 100 units will only raise your blood level by 1. If you're in this range, and I guarantee that you and your patients are, if they're not on a vitamin D supplement, as I said, 1,000 units a day will not make you sufficient. I recommend make it simple. Adults, 2,000 units a day. Children, 1,000 units a day. Or for your patients who want to take every other week, 60,000 units every 2 weeks is ideal, in my opinion. Conquer vitamin D deficiency. Best source, sunlight, but time of day, season, latitude, degree of skin pigmentation. So what's a person to do? There's only one thing to do, develop an app. And so we have. And if you go to this app, dminder.info, it's free on your Android and iPhone. It will tell you even in India how much vitamin D you can make, when you can make it. It regulates, it tells you relative to your skin type and age, and it warns you to get out of the sun so you don't get a sunburn. What do? Sun protection on my face, but not on my arms and legs. And I, like all of my family members, I take 6,000 units of vitamin D a day. My blood level, 72 nanograms per ml. Vitamin D deficiency is probably the most common medical condition worldwide. If any one of these chronic illnesses turn out to be associated, right, we now know vitamin D is critically important for immunomodulation, reducing risk for autoimmune diseases. And now with COVID-19, I think it's very important to not only reduce risk of acquiring the infection, but mitigating many of the complications and mortality associated with it. There is no downside to increasing your vitamin D intake. You don't need to be a genius to know this. We need sensible sun and vitamin D supplement recommendations. This is not a hypothesis. So should you be screening everybody? I've hopefully convinced you no, right? But if you do have sarcoid or malabsorption or on medications like prednisone and anti-seizure medications, then you need to follow them because you may need to give them more vitamin D to satisfy that requirement. Or in the case of sarcoid, you need to minimize how much vitamin D that you give. I've written a book called The Vitamin D Solution. I don't think there's any question. Vitamin D can help improve your health. And I thank you for your kind attention.
Prof, this is Dr. Krishnan Swaminathan, moderating your session from Coimbatore. I thought that was just such a mind-blowing talk, covering all aspects of vitamin D. And to be very honest, for an endocrinologist like me, we've been very conservative, worrying about all the toxicity. And I think you made it clear the amount of vitamin D that's needed. So if it's okay, I'll just start with the first question. All these associations with vitamin D and autoimmune disease, cancer, and heart disease is fine. But is there any evidence saying that treating with vitamin D reduces the risk of these problems?
It's a good question. And I'm sure that part of the reason for the question is that the VITAL study that came out, published in the New England Journal of Medicine, right, that this was over 15,000 healthy adults that were given 2,000 units of vitamin D a day for 5 years. And they showed no benefit in reducing risk of cardiovascular disease or cancer. But as I tell my students and my fellows, please always read the paper. Don't just read the abstract. If you read the paper, guess what? more than 50% of the subjects at baseline had a blood level of 25-hydroxy vitamin D of 75 nanomoles per liter or 30 nanograms per ml. So that means more than 50% of that study group were vitamin D sufficient. So if you're giving vitamin D to a sufficient person, why would you expect there to be any benefit? However, what they did find, which was remarkable, is that those that took vitamin D and had cancer, it reduced their risk of mortality by 25%. That was statistically significant. A similar study was done called the D2D study, which was a pre-diabetes study where they also got dose of vitamin D and showed no benefit in preventing them from going from pre-diabetes to diabetes. But again, it's the same problem, is that many of them were vitamin D sufficient, and that dilutes out the observation. In my opinion, based on all of the literature and the mechanisms of action of how 125 dihydroxy vitamin D works, that there's very good evidence that vitamin D will improve your health. And I'll just leave you one last thought, which is, we also did another study and asked the question, can you dissociate the calcemic effect of vitamin D from the non-calcemic health benefits? And we gave healthy adults either 600, 4,000, or 10,000 units a day for 6 months. And we did whole expression analysis at the beginning and end of their white blood cells. For the 600 unit dose, about 150 genes were altered. 4,000 unit, about 300. On 10,000 units a day, 1,200 genes were up or down regulated. There was no toxicity at 10,000 units of vitamin D a day, and the PTH levels dropped on 4,000 and no significant additional decrease at 10,000. So we believe higher doses of vitamin D have additional health benefits above and beyond the calcium and bone effect.
Sure. One more question is that, is there any absolute contraindication? For example, we do see hypervitaminosis D in elderly people with renal failure, where some of the physicians are over the top with their vitamin D prescription. So would you want to temper situations where you would think we need to be very cautious about overdoing with vitamin D? Any absolute contraindications?
Yeah, it's an excellent question. So herein lies the problem, right? People think when they're giving calcitriol, 125 dihydroxy vitamin D to patients with CKD, that's vitamin D. It's not, right? Even the KDOQI guidelines, so the International Kidney Foundation guidelines, recommends that all patients with CKD should maintain a blood level of 25-hydroxy vitamin D of at least 30 nanograms per ml, 75 nanomoles per liter. Only calcitriol, giving it in higher doses, will definitely cause hypercalcemia. But vitamin D at the recommended doses that I've just said from the Endocrine Society will not cause vitamin D intoxication in patients with CKD. But the vitamin D analogs, the active analogs, will. So you need to be careful with their use. And finally, even if you have no kidney function and you cannot make any 125 dihydroxy vitamin D, you should definitely treat your patient with vitamin D. Why? Because your parathyroid glands have 1-hydroxylase activity, and we know that the local production of 125D will decrease PTH.
Sure, great. Prof, I hope you've got time for a few questions from the audience now.
Please.
One of the audience is asking, is there a vegetarian source of vitamin D?
Excellent question. So for sure, mushrooms, right, exposed to sunlight. So you have to expose them to sunlight, right, is an excellent source of vitamin D2. There is essentially no other plant source that provides you with vitamin D2.
Right. One more question is that in an Indian context, what would be the maintenance dose? Do you still think twice weekly 60K would be useful, or once a month?
So in my opinion, like I said, I have all my patients on 50,000 units every 2 weeks. And so 60,000 units every 2 weeks is, in my opinion, the amount that you need to maintain that blood level in that range of 40 to 60 nanograms per ml. So not once a month, right? Because that's equivalent to about 1,500 units of vitamin D a day, right? 60,000 units twice a month, you're getting in the range of about 4,000 units a day, which in my opinion is ideal.
Great. And one more question in the context of COVID-19, which you illustrated very nicely. Is there any blanket treatment in terms of all COVID-19 patients should be given this dose of vitamin D? Is there anything that you have in mind?
So in my opinion, there is absolutely no downside to be giving vitamin D to COVID-19 patients as soon as they enter the hospital. There's a recent study that just came out from Brazil saying that they gave a 200 unit dose to COVID patients, and they didn't see any change in any of the outcome measures or mortality and morbidity. In my opinion, I think that there is no downside to giving vitamin D, right? We have a study underway right now in Iran where we're giving actually 25 hydroxy vitamin D, so that we're rapidly raising the blood levels of 25 hydroxy vitamin D. And it appears that it may have some benefit. And that's consistent with a recent study out of Spain who made a very similar observation. So in my opinion, I recommend to my COVID-19 patients that are in the hospital, I make sure that they're getting an adequate amount of vitamin D. I give them a 50,000 unit dose immediately upon entrance if they aren't taking it already.
Right. Just a couple more. One of the audience is asking, all children with severe vitamin D deficiency do not develop rickets. And why do you think that could be? And do we need to supplement with calcium in patients with severe vitamin D deficiency as well?
Right. So as you probably know, in India and Bangladesh, for example, a major cause of rickets is calcium deficiency. So you always need to make sure that these infants are getting an adequate source of calcium and vitamin D. The problem that people have with rickets is that they have this idea that you have bowed legs, short stature. That only occurs after about 1.5 to 2 years. But vitamin D deficiency in infancy causes infantile rickets. And you can see that histologically if you were to take a bone biopsy. So yeah, you're right. You don't see the obvious right in the epiphyseal plates or the bowed legs until about 1.5 to 2 years. But infants still have infantile rickets, and they're constantly removing calcium from their bones. So I often tell my fellows the following: when an infant's vitamin D deficient, two things are happening, right? The first is you're increasing parathyroid hormone level. That's decreasing your phosphate level. And therefore, you cannot get proper mineralization of any new matrix that's been laid down, right? Osteomalacia and rickets is a mineralization defect of the osteoid. But you now have another problem, because if the PTH is going up, right, you're now increasing osteoclastic activity, and now you're starting to erode the bone and causing it to become more porous and increasing risk ultimately of fracture. So yes, infants are vitamin D deficient, they have infantile rickets. You just don't see it, obviously, because on physical exam, you won't pick it up. And just one other point, which is that sometimes you'll see a bowed forearm. And the reason is that vitamin D deficiency causing that mineralization defect, right? That the very flexible bone is just muscle tugging on that bone will cause it to bow. And so you often see that even within the first year of life.
Sure. And just one final question from me before I hand it over to Satish Kumar to wrap up the session. We do see quite severe hyperparathyroidism presenting with low vitamin D. And it's like threading a needle as to what dose of vitamin D we should give to make sure that we don't make them more hypercalcemic. Your thoughts?
Excellent question. And it turns out that this is a myth, right? We've published, and Dr. Gray, there's at least 3 publications out there to show you can give hyperparathyroid patients vitamin D and not worry about their calcium going up. Often it will come down.
Yeah.
In fact, the reason for you being vitamin D deficient when you have primary hyperparathyroidism isn't because the kidneys are converting 25 hydroxy D to 125D more efficiently. It's because the 125D is stimulating the 24 hydroxylase, and the 24 hydroxylase now hydroxylates 25 hydroxy D, inducing it ultimately to have the side chain clipped being made water soluble. And so, yes, patients with sarcoid and with hyperparathyroidism are more likely to be vitamin D deficient because of that mechanism. But in patients with hyperparathyroidism, most definitely you should correct their vitamin D deficiency, and the amount is not related to their PTH levels.
Sure. Thank you very much, Prof. I would hand it over to Satish. I just want to finish by saying that we really enjoyed your slides as well, from chimpanzees to Donald Trump. It was mind-blowing. Hillary Clinton, you got our Narendra Modi too, so thank you very much. And we really wish you come to India once in person, so it would be great to meet you. Satish, I'll leave it to you to wrap up this session.
Thank you so much for your kind comments.
Thanks from my side too, sir. It was an exhaustive talk, and we enjoyed it thoroughly. Thank you so much.
Thank you, and have a delightful evening. Bye-bye.